In this video, we will solve several dosage calculation problems for critical care medications in which the order is given in micrograms per kilogram per minute or in some kind of units per kilogram per minute, and you are tasked to program your pump in milliliters an hour. How is it done? Let's take a look at our first problem. The order is nitroglycerin 0.25 microgram per kilogram per minute. Patient weighs 70 kilograms. Available nitroglycerin 50 milligram in 250 milliliter bag. How many milliliters an hour does the nurse program the pump to infuse this medication? Let's start with this order right here. It is kind of messy, right? We have micrograms, we have kilograms, we have minutes. Let's clean it up a little bit. So if 0.25 micrograms per kilogram, then for my patient, I need 70 times that. And if this amount is ordered per minute, then in order to go to per hour on my pump, I need to multiply by 60 because there are 60 minutes in an hour. And I found this to be 1050 micrograms, and I'm no longer per kilogram, right? I'm already per my patient weight, and I'm no longer per minute, I'm per hour now. So this is how many micrograms per hour my patient will be receiving. Now, oftentimes, this is not very intuitive for students, okay? They see these per lines and they think right away, I need to divide, but then they think maybe I need to multiply. So it's not intuitive and they question themselves and make mistakes on the test. So how do I know that I have to multiply by these numbers? If we set it up as a DKP method, it can show us. So let's go first per kilogram. So to use DKP method, I'm writing first, what do I know? I know that 0.25 micrograms is per 1 kilogram of body weight. My patient weighs 70 kilograms. How many micrograms should my patient get? I put microgram under microgram, kilogram under kilogram. I multiply on the diagonal and I divide by the third number. And you can see that the method shows us that we just do 0.25 times 70, just like we did here. The same with minutes. .25 micrograms is going per 1 minute. I have 60 minutes in an hour. How many micrograms is that for 60 minutes? So 0.25 microgram is going per 1 minute. X microgram is going per 60 minutes. And again, I'm not touching my X. I'm multiplying on diagonal the two numbers that are not X, and I'm dividing by the third number. And you see, all we're doing again is multiplying 0.25 by 60. So going back here, we just multiplied 0.25 times 70 times 60, and we got our 1050 micrograms per hour. So you see that when you're in doubt, do I multiply or do I divide in these complicated problems? Always set it up as a DKP method, and it will help you realize what it is that you're doing, multiplying or dividing. Just remember, keep in mind that I need to check, do I have my same under the same measure? If I'm working with minutes, they have to be under minutes. Micrograms have to be under micrograms, right? I cannot put minute here and hour here, for example, right? And I cannot switch my kilograms and micrograms. They have to be the same under the same. Then you're multiplying on diagonal that doesn't have an X in it, and you're dividing by the third number. So let's keep going with our problem. We found that 1050 micrograms are going to be administered per hour. How do we get now to milliliters? Because the question is to program the pump in milliliters per hour. Well, the available bag for us is 50 milligram in 250 milliliters. So we need to bring these micrograms to milligrams in order to be able to use them in this concentration. And again, I'm going to be using DKP method here because it's not intuitive for me. Do I multiply? Do I divide? And many times you guys make mistakes when you try to convert numbers. You know that milligram to microgram is 1,000, but which way 1,000? This way or that way, and you make a mistake going the wrong way. If you use DKP method, it's going to show you which way to go. So I'm writing 1,050 microgram is X milligram, but what do I know about micrograms and milligrams? I know that 1,000 micrograms make 1 milligram. I'm multiplying on diagonal and dividing by the third number. And I get that my X equals 1050 times 1 divided by 1,000. And you can see that it shows you right away, yes, all you do is 1050 divided by 1,000. So I found 1.05 milligram equals to this number of micrograms that I calculated per hour. So this many milligrams per hour patient will be receiving. Now I just need to plug it into my concentration, 50 milligram per 250 milliliters. And I'm writing 50 milligram is 250 milliliters. I need to find 1.05 milligram. 1.05 milligram is X milliliters. I double check myself. Do I have the same measure under the same measure? I multiply and I divide. So 1.05 times 250 divided by 50 equals 5.25 milliliters an hour. Here's our next problem, and you will see that this is like the opposite of what we just did. The order nitroglycerin 5 microgram per minute continuous IV infusion via non-absorptive tubing increase by 5 microgram per minute every 3 to 5 minutes as needed up to maximum of 20 micrograms per minute. Currently, nitroglycerin is infusing at 6 milliliters an hour from a bag marked 50 milligram of nitroglycerin in 250 milliliters of D5W. How many micrograms per minute is the patient currently receiving? And you see that this is almost the opposite of what we had before, right? Milliliters an hour here are given, and we are tasked to find micrograms per minute. And why is it done? Let's say you come in on a shift and you see nitroglycerin order, this order that's written out here, and you see that on a pump it's going at 6 milliliters an hour, and you want to know, is it still going at an appropriate micrograms per minute rate? So let's find out if it is or it isn't. There is a lot of information given in this problem, and you as a nurse need to be able to pick what is relevant for us and what is not. So let's look at the question, how many micrograms per minute is patient currently receiving? Keeping this question in mind, let's look at all this information and see what we actually need from here. We need to know current infusion rate in order to determine currently how much we're receiving. So currently nitroglycerin is infusing at 6 milliliters an hour. That's all we need to know for now. And we need to find how many micrograms per minute is that. So going from milliliters to micrograms and from hours to minutes. Let's start with our hours. I'm going to use DKP method to help me because it's not intuitive for me whether I need to multiply by 60 or divide by 60. I understand that to go from hours to minutes, I need to involve 60 somehow because there are 60 minutes in an hour. But again, it's not intuitive. I don't know, do I multiply by 60? Do I divide by 60? So I'm going to set it up. and say 6 milliliters are going over 60 minutes, that's 1 hour, right? To go to minutes, I'm going to put 1 minute here, is X milliliters. So 6 mLs over 60 minutes, how many mLs over 1 minute? Multiply and divide. And I find that 6 times 1 divided by 60 is 0.1 milliliters my patient is receiving per minute, right? X milliliters per 1 minute. And I found that to be 0.1. Next, I need to go over here into my bag, my concentration that's given, and see how many milligrams per how many milliliters. So I can go from my milliliters to my milligrams and then eventually to micrograms. So 250 milliliters is 50 milligrams. And I write it just like that. 250 milliliters is 50 milligrams. I need to find how many milligrams is 0.1 milliliters. I carefully put my milliliters on the milliliters and my milligrams on the milligrams. As always, I multiply on diagonal and divide by the third number. And my X equals 0.1 times 50 divided by 250. And that equals 0.02. And I found milligrams, and I'm still per minute, yes? This is how many milligrams patient is receiving right now when patient is receiving 6 milliliters an hour. Now I need to go to micrograms from here because the question is asking me how many micrograms per minute is that. And again, if you guys do it in your head intuitively, going from milligrams to micrograms, you all have different methods to do it, that's fine. But if you don't do it well in your head, if it's not intuitive for you, go ahead and set it up as DKP. 0.02 milligram, I don't know how many microgram that is. But I know that 1 milligram is 1,000 microgram. Again, I check myself. Do I have my milligram under milligram? Microgram, same under the same. And then I multiply on diagonal the two numbers that are not X, and I divide by the third number. And it shows me exactly what to do, how to convert my milligram to microgram. I just need to multiply by 1,000, and that equals to 20 microgram. I know I found microgram because I set my X to be microgram, and I know I was looking for per minute number, right? So that would be my answer. Right now, my nitroglycerin is infusing at 20 micrograms per minute. And this is already the top rate that we want to have per order. So we don't want to exceed that. Good thing we checked, yes? And here's our last problem. Order normal saline 1000 milliliters IV with 40 grams of magnesium sulfate. Start with bolus of 4 grams over 30 minutes. And then maintain continuous infusion at 1 gram per hour. And we have two questions in this problem. What is the flow rate in milliliters an hour for the bolus? Because we need to tell the pump how to infuse, right? And pump, they only understand milliliters an hour. So we need to find milliliters an hour for each one of them. And two, what is the flow rate in milliliters an hour for the infusion? Let's not get overwhelmed here with these two questions. Let's do one thing at a time. So first of all, what's the flow rate in milliliters an hour for the bolus? What do we know about the bolus? We know that it should go at 4 grams over 30 minutes. Now, what is it in milliliters per hour? Let's see, concentration given 1,000 milliliters is 40 grams. Let's write it down just like that. We're going to use DKP method. So 1,000 milliliters is 40 gram. I need to give 4 gram. How many milliliters is that? Milliliters under milliliters, grams under grams. I'm ready to multiply and I'm ready to divide. 1,000 times 4 divided by 40 equals 100. 100 milliliters I found. That's how many milliliters we'll be infusing over 30 minutes. Now I need to figure out what is it per hour. And if it is intuitive for you to go from 30 minutes to an hour just thinking, oh, I just need to double that, that's great. But if it's not intuitive for you, I see students make mistakes here all of the time, even though it seems pretty easy, but we somehow get confused. Go ahead and set it up as DKP method. So we know that 100 milliliters should be going over 30 minutes. So 100 milliliters is 30 minutes. I need to find what is it per hour. And my hour has 60 minutes. Remember, I can't put minutes and hours one under another, right? It has to be all in hours or all in minutes. So 30 minutes, 60 minutes is X milliliters. I'm going to multiply these two numbers and divide by 30. 100 times 60 divided by 30 equals 200. 200 milliliters an hour. And see, it was as easy as just multiplying our 100 that we found before. But sometimes numbers may not be so easy to calculate, right? And we cannot do it in our head. So if you can't, go ahead and set it up instead of making a mistake. What if I give you here 45 minutes? That makes it not so easy anymore, yes? All right, we found the answer for our first question. 200 milliliters an hour will be our bolus. Now let's answer question number 2. What is the infusion rate in milliliters an hour? And what's given for infusion here? 1 gram per hour. So I'm writing 1 gram is X milliliters because I need to find milliliters an hour, right? I'm given gram an hour, I need to find milliliters an hour. So 1 gram is X milliliters. But again, I know that 40 gram is 1,000 milliliters. I'm putting gram under gram. And I put my milliliters under milliliters. 1 times 1,000 divided by 40. And that equals to 25 milliliters an hour. We don't need to convert any time in this second question because it's already given us per hour. There's nothing to worry about with minutes. And these are our answers. For the bolus, we are going to put in a pump 200 milliliters an hour to infuse. And for the infusion, we're going to put in a pump 25 milliliters an hour to infuse. You will find more problems like these in my book, Dosage Calculations, Getting It Right Every Time.